Hello, my name is Dan Diekema. I'm an infectious disease physician, clinical microbiologist, and a healthcare epidemiologist at the University of Iowa in Iowa City, Iowa. And I am here to convince you to be sure to attend the 31st ECCMID meeting. I want to tell you why I love ECCMID so much and a couple of the sessions that I really look forward to coming up soon. So when I think about ECCMID, I think about my first meeting that I attended. For many years, I didn't attend, which I really regret at this point. But a little over 5 years ago, we were struggling with a very nasty outbreak of Mycobacterium chimera infections in a small number of our patients who had undergone cardiac surgery. And it was through the work of a lot of really amazing investigators in Europe, led first by Professor Hugo Sachs and his colleagues, Professor Barbara Haas, Professor Rami Summerstein, Jack Van Ingen from the Netherlands, were all really instrumental in piecing together what was going on here, kind of finding the smoking gun within the operating room and helping to guide our prevention strategies to kind of quash this cluster, at least at our university, but at the same time recognizing that this was really a global outbreak with a very interesting origin and a point source that these investigators really helped to identify. So it was really wonderful for me to be invited to ECCMID to talk about the Mycobacterium chimera outbreak, but more importantly, to meet all of these wonderful colleagues, to compare notes, to talk about how we move forward, and also from a very practical standpoint, getting advice on the very difficult management of infections in the unfortunate patients who were infected with Mycobacterium chimera. So that was really my first experience at ECCMID, and I have not missed a meeting since then. It's a wonderful way to connect with colleagues from around the globe, as I said, to compare notes across countries and continents. And what really strikes me about the ECCMID meeting is the way that it integrates new knowledge into a better understanding across multiple disciplines. Epidemiology, diagnostics, treatment, prevention. So whether you're a basic scientist, a clinical investigator, clinician, clinical microbiologist, healthcare epidemiologist, public health professional, you can find important and relevant information at ECCMID. Even though it's a really large meeting, as a program committee, we work very hard to connect these disciplines, to have sort of cross-disciplinary sessions, and also work very intentionally to make sure that the experts that present this material and that participate in the workshops and all the symposia are a diverse group of experts. So I really look forward to the 31st meeting. Of course, there's going to be fascinating and very helpful information presented on the COVID-19 pandemic, given the amazing amount of progress that we're making understanding all aspects of this pandemic, but also the really painful lessons that we've learned along the way. But more exciting to me even than catching up with colleagues on the pandemic is to revisit all the other issues that we haven't been paying as much attention to over the past year, because, of course, we're distracted by responding to this unbelievable pandemic. So malaria, TB, HIV, antibiotic resistance, of course, all these things continue to cause suffering and death across the globe. And how we investigate, diagnose, treat, and prevent them has also been impacted by the pandemic. So a couple of sessions that I'm really looking forward to include, for example, one on an update on whole genome sequencing to predict antibiotic resistance phenotypes across multiple different genera, and including Mycobacterium tuberculosis, which is really essential to more accurately, rapidly optimize antibiotic therapy to reduce the emergence of antibiotic resistance. Another symposium I'm really looking forward to is an update on the use of shorter and simpler treatment courses for common bacterial infections, which is another obvious way to both improve outcomes in the near term and reduce antibiotic resistance in the long term. And then finally, on the same topic, I look forward to a session on One Health approach to antimicrobial resistance and the interplay between human health, the natural environment, agricultural practices, water quality, all these things that we need to tackle if we want to curb what is also, in a sense, a global pandemic, which is that of antimicrobial resistance. So it's all going to be very fascinating, and I look forward to seeing you there. It'd be wonderful if it were in person. Maybe it will be. In all likelihood, though, for me, it will probably be virtual. It depends, I suppose, on which side wins the kind of ongoing race we have now between the SARS-CoV-2 variants and our ability to distribute vaccine around the world. So thanks very much for listening, and I hope to see you, at least virtually, at the 31st ECCMID. Thank you very much.